first step to completing a health history is gathering biographic information about your client. This is the initial step in understanding your client. It provides the nurse with a data set from which you can begin to make your first judgments. It goes something like this. Hello, sir. My name is Mackenzie. I'll be your nurse today. What is your name?
Steve Young.
What is your address?
708 South Main Street.
And your age?
42 years old.
Your date of birth?
March 17th, 1977.
Your birthplace?
New York City, New York.
What is your gender?
Male.
Your marital status?
Married.
Does your wife offer you a sense of support?
Yes.
What racial group or ethnic group do you identify with?
African American.
How closely do you identify with them?
Very close.
Do they offer you a sense of support?
Yes.
What religion do you identify
I'm
with?
Catholic.
How closely do you identify with your religion group?
Very close.
Do they also offer you a sense of
Yes.
support? In times of need, would you turn to your religion?
Yes.
What occupation are you in?
I am an accountant and a CPA.
With this, do you do a lot of sitting down?
Yes.
Right. So in accounting, it is important to remember to walk around frequently so that you can get your blood flowing. Do you walk around, take a lot of walks around the
I
office?
try to.
All right. What health insurance do you have?
I have NBH health insurance.
Then while you are gathering your biographic information, you want to make sure that you have a source of information, which in this case, my source of information is the client, Steve Young. He is a primary source of information, which makes him extremely reliable, since he is the first source to his own health. The second part of conducting a health history on a client is asking about their present health or illnesses. Today I'm going to go over their reason for seeking care, health beliefs and practices, health patterns, their medications, prescriptions, and over-the-counter. It'll go something like this. Hi, Steve. What is the reason you came in today?
I am here for a follow-up after being hospitalized for chest pains.
All right. And are the chest pains gone now?
Yes.
Okay. What do you think it means to be healthy?
It means eating healthy and staying active.
What are the reasons people become sick?
Germs and diseases.
Do family members think the same?
Yes.
Do you use any cultural remedies?
No.
Do you use any home remedies?
No.
Where do you get your source of health information?
From my doctor.
Alright. About how many hours would you say you slept a night?
6 to 8.
Alright. Do you go to the doctor frequently?
No.
Alright. Do you at least go whenever you're feeling ill?
Yes.
Right. So I'm going to recommend that you promptly start going to regular checkups, getting a primary care physician. Right. Do you take any medications?
I take over-the-counter pain medication when I have migraines.
Right. What medication is it?
Ibuprofen.
Do you know how much you take?
No.
Like how many tablets you take?
3.
You just want to try to make sure you're taking 1 or 2, like it says on the bottle. The third part in conducting a health history on your client is getting their past medical history. By doing this, you're going to ask them about things such as surgeries, hospitalization, outpatient care, childhood illnesses, immunizations, mental and emotional health, allergies, and substance use. It will look something like this. Hi, Steve. Have you had any surgeries in the past?
I have had no surgeries.
Have you been hospitalized recently?
Yes.
What for?
My chest pains.
And are they gone now?
Yes.
What was your diagnosis at your recent hospitalization?
I was told I suffered from some mild heart damage.
Do you receive any outpatient care anywhere?
No.
And did you have any childhood illnesses?
I had chickenpox as a child, but no other surgeries or major childhood illnesses.
Are you up to date on all your immunizations?
Yes.
Do you get the flu shot?
Yes, every year.
What's your mental and emotional health like? Do you have any mental issues?
Other than feeling stressed out a lot, I am happy with my life and family.
That's great. I'm glad to hear it. Do you have any allergies?
No allergies.
Do you use any substances such as alcohol, cigarettes?
I have occasional alcohol use, and I have smoked about a pack a day for the past 15 years. And I've tried to quit many times using gum, but
All right. So I'm going to relate that to your physician so that maybe we can find something to help you start to work on getting past it if that's an option you would like to take. Also, when you use alcohol, do you do it safely?
yes.
All right, very good. The fourth step to conducting a health history on your patient is gathering a family history, and it looks something like this. Hi, Steve. Does your family have a history of heart disease?
My family has no history of coronary artery disease.
Hypertension?
No.
Stroke?
No.
Epilepsy?
No.
Migraine headaches?
No.
Diabetes?
No.
Asthma?
No.
Cancer?
No.
Allergies?
No.
Anemia?
No.
HIV?
No.
Do you have a family history of mental illness?
No.
Alcoholism?
No.
Is your mother living?
Both my parents are still living in good health.
Good. And how many siblings do you have?
I have no siblings and very few extended family members.
All right. Thank you. The fifth step to conducting a health history on your client is by conducting a psychosocial history. Through this, you want to ask questions related to occupational history, education, financial background, roles and relationships, family, social structure, emotional concerns, and self-concept. It might look something like this. Hi, Steve. What has your occupational history been like?
I am an accountant and a CPA, and I've worked for the same firm for many years.
And what was your education like to get there?
I graduated from Fredericktown High School, and I graduated from Hannibal-LaGrange University with a bachelor's in accounting.
Right. And does your financial background support you where you don't really have many worries?
Yes.
That's great. Do you have many friends?
Yes.
Do you use them as a source of support?
Yes.
What are your relationships like at work?
Great.
That's great. What is your family like?
I have a wife named Angie and 2 children, Kelsey, who is 7, and Marcus, who is 6. My wife is currently pregnant with our 3rd child, and I met her in college.
What are your relationships like with each of your family members?
They're great.
Good. Do you have any emotional concerns today?
No.
And how do you feel about yourself?
Feel great.
Great. The sixth step to completing a health history on your patient is by doing a review of their systems. First, you're going to do a general survey of your patient, looking at their appearance, mental status, posture, gait, hygiene, grooming and odors, expression, mood, appropriateness of responses, speech, organization, thoughts. You want to make sure you're doing this throughout your whole assessment, but especially when you want to review systems. Next, I'm going to ask about your hair, skin, and nails. Have you ever had a rash, itch, lesions, wounds, incisions, scars, nails, hygiene, or hair loss?
No, but I have flaky skin. I use an over-the-counter dandruff shampoo.
Alright, now I'm going to ask you about your head and neck. Do you ever have headaches?
I occasionally suffer from migraine headaches and have since college. Over-the-counter pain medication usually takes care of them, but sometimes they last for 2 days.
Alright. Do you have any dizziness?
No.
Seizures?
No.
Are your lymph nodes enlarged?
No.
Alright, now I'm going to ask you about your eyes. Do you have a vision impairment?
I have no vision problems.
So you don't wear glasses or contacts?
No.
Alright. What was your last eye exam?
Last week.
Who's your eye care provider?
Dr. Byer.
And now I'm going to ask you about your ears. Do you have a hearing impairment?
No. I have no hearing problems.
Alright, that's great. Now I'm going to ask you about your nose, mouth, and throat. Do you have a history of nosebleeds?
No.
Decreased sense of smell?
No.
Frequent colds or nasal congestion?
No.
A history of sinus infections?
No.
Frequent sore throats?
No.
Cold sores?
No.
Gingivitis?
No.
Dental caries?
No.
Missing and broken teeth?
No.
Do you have dentures?
No.
When was your last dental visit?
Last week.
And who's your dental care provider?
Dr. Velmer.
Alright. Sounds good. Alright, now I'm going to assess your thorax and lungs. So, do you ever get short of breath?
No.
Alright, do you use an inhaler or nebulizer treatment?
No.
Alright, do you ever have a cough?
No.
You don't use oxygen?
No.
Okay. Now I'm going to ask you about your heart. Do you have tachycardia?
No.
Bradycardia?
No.
Do you have an arrhythmia?
No.
Do you have a murmur?
No.
Do you have varicose veins?
No.
Do you have peripheral vascular disease?
No.
Do you have any edema? Are you
No.
swollen anywhere?
No.
Right. Do you have any pain or numbness in extremities?
No.
Do you have a history of deep vein thrombosis?
No.
Do you have hyperlipidemia?
No.
Who's your cardiologist?
Dr. Cardi.
Alright. Do you have any pain or tenderness in your breast or axilla?
No.
Do you have any nipple discharge?
No.
Do you have any lumps?
No.
Have you ever had a mastectomy?
No.
When was your date of your last self-exam?
2 weeks ago.
Alright, and now we're going to go down to your abdominal or your gastrointestinal system. How frequent are your bowel movements?
Every day.
Alright, when was your last bowel movement?
2 hours ago.
That's great. And can you describe it?
It is normal.
Like warm and brown?
Yeah, it's just a normal.
Do you use any laxatives?
No.
Do you have constipation?
No.
Diarrhea?
No.
Flatulence?
No.
Hemorrhoids?
No.
Do you have bloody stools?
No.
Incontinence?
No.
Now we're going to move on to your urinary system. Do you have a frequency of urinating?
No.
Do you have urgency?
No.
Retention?
No.
Hematuria?
No.
Dysuria?
No.
Nocturia?
No.
Do you have recurrent urinary tract infections?
No.
Are you incontinent, which means you can't go to the bathroom by yourself?
No.
Do you have renal calculi?
No.
Do you have renal failure?
No.
Are you on dialysis?
No.
Do you have hesitancy, dribbling, or decreased force of stream?
No.
Do you have a prolapsed bladder?
No.
A neurogenic bladder?
No.
Have you ever been catheterized?
No.
So you don't have a catheter?
No.
Alright. Then we're going to go to your musculoskeletal system. Do you have a decreased range of motion or mobility?
No.
Do you have any pain, stiffness, spasms, or tremors?
No.
Do you have a gait disturbance?
No.
Do you have impaired balance?
No.
Do you have scoliosis?
No.
Do you have prosthetics?
No.
Do you have any foreign bodies or implants?
No.
Do you have a history of fractures?
No.
Alright. Now we're going to move on to your neurological, which you said you had a headache with migraines, right?
Yes.
Alright. Do you have any one-sided weakness?
No.
Memory loss?
No.
Confusion?
No.
Changes in speech patterns?
No.
Do you have dementia or Alzheimer's?
No.
Do you have any weakness?
No.
Paralysis?
No.
Do you have a history of a head injury?
No.
Loss of consciousness?
No.
Neuropathy?
No.
Alright, we're going to move on to your reproductive system. Do you have any discharge?
No.
Testicular pain?
No.
Swelling?
No.
Lumps?
No.
Have you ever had infertility problems?
No.
Do you have erectile dysfunction?
No.
Do you know if you have an enlarged prostate?
No.
Do you have any STIs?
No.
Alright, what was the date of your last self-testicular exam?
6 weeks ago.
I think I would try and do them about once a week, just to be really safe. I think it's recommended that you do it in the shower. And just don't have time with that. Have you ever had an abnormal testicular exam?
No.
Alright, we're going to move on to your endocrine system. Do you have excessive thirst or hunger?
No.
Do you have increased urination?
No.
Hair loss?
No.
Skin changes?
Just the flaky skin.
Alright. And you treat that with dry shampoo?
Danger.
Sorry. Have you ever had anemia?
No.
Goiter?
No.
Intolerance to heat or cold?
No.
Height flashes?
No.
Jaundice?
No.
Ascites?
No.
Alright, and what's your mental health like? Do you have anxiety?
No.
Depression?
No.
Irritability?
No.
Mood swings?
No.
Difficulty concentrating?
No.
Suicidal ideation?
No.
Abnormal thoughts?
No.
Difficulty sleeping?
No.
Are you doing any therapy?
No.
Who's your mental health care provider?
Dr. Schultz.
Alright, what's your health perception? What is your health perception?
I feel like I'm a healthy being.
Alright, great. Alright, that's all I have today.